Okay, we're going to go to Edisto Island, beautiful Edisto Island, where we have Dee Dee on the line. Hi, Dee Dee. How are you today?
I'm good. How are y'all?
Doing great.
Doing great.
I wanted to ask you. I have a tiger cat. He's an FIV positive. He's about 2 years, 2.5 years. He was a little dumpster kitten, and he's been doing well, except for he had an infection in his gums. I took him to the vet last week, and she gave him an antibiotic shot, and that lasts 10 days, I believe. And we had talked about having the teeth, his back molars, they were decayed, and having them extracted. And I'm just real nervous about it and wanted to get your opinion on the risk involved and if there's anything else that can be done. Should the teeth remain, or should, I know they cause other problems,
right?
Especially in FIV cats.
Mm-hmm. Right.
Yeah.
And
good questions. Yeah. Good concerns. Yeah.
And that is a good concern, and it's perfect timing. This is National Pet Dental Health Month. We hadn't even mentioned that, but and cats do get, even if they're not FIV positive, there are certain population of cats that will get what's called stomatitis or feline stomatitis, and there's not a good answer necessarily as far as what the originating cause is. There's some competing theories on whether it's a bacteria that's in the mouth, whether it's actually like an autoimmune type disease, and then you get the secondary bacterial infections and ulcerations on top of that. Mm-hmm. A lot of times what happens is we do antibiotics and then also cortisone injections or steroid injections to kind of try to keep it at bay. In some cats that may work great and last for 8 months, 10 months, something like that, and then then it's back. But if we do have significant dental disease in there associated with it too, then or if it's perpetual, that it's just you have to constantly treat it, then the best thing really is to do extractions and get those teeth out of there. So if we've got teeth that are abscessed and nasty and harboring those bacteria up the roots and everything, those teeth need to be out of there. From a standpoint of risk in a 2-year-old kitty, if everything else is okay, there's no difference in anesthesia risk for that than there is for neutering. As far as being an FIV positive kitty, that's something that we kind of have to take with a grain of salt, because our FIV positives, what we have is we have a test that tests for the antibody to FIV, and so with it, we're not necessarily testing and seeing the FIV present there. This could be a kitty who, there's kitties who are FIV positive who live 12, 13 years. It's not like the feline leukemia, and so we may not truly have any effect from being an FIV positive cat. And so really, if all his other blood work, everything else, body condition, everything else is in good condition, then I wouldn't think that should limit him as far as or hurt him as far as anesthesia risk.
How long is the recovery period, and do they have, is it pretty quickly, or does it take a long time for them to recover? Does their mouth, their head swell up?
No, most of the time they recover very quickly, and usually the thing that people notice is that people worry about, well, if you take those teeth out, because those are the back ones where they chew with, are they going to have problems eating? And a lot of times, because of the pain and inflammation in the gums back there, those teeth may be loose or problems too. That a lot of times they eat much better than they did beforehand. So so it's
it could actually be very positive. Yeah.
Yes.
He eats a lot as it is, and he's gained weight, and he weighs a good weight, at least about 9 pounds.
Yeah.
But he had one other condition called pillipad, which that's these lesions that break out on his little pad.
Yes, ma'am.
Yes.
And the vet gave him some steroid shots for that every few months when that happens.
Right.
It usually happens anywhere from 3 to 6 months.
Right, and that in theory makes me think more along the lines of he might truly have stomatitis then too, as far as that goes, because those are immune mediated. Both of them are immune mediated conditions, and so it may be that the extractions are going to be the better thing for him as far as long term.
Oh.
Yeah.
Okay.
Yeah.
Could
all work together.
I didn't want to lose him. I've lost one cat recently.
Yes, ma'am.
Something else, and I just wanted to make sure that I didn't do something that would cause his demise.
Yeah.
I'd like to have him around a little longer. So.
Yes, ma'am. Yep. Yes, ma'am. Absolutely.
Okay. Yeah. Okay. Well, thank you so much. I appreciate
you're welcome.
it.
Thanks, Dee Dee.
Okay.
Yep.
Bye-bye.
Bye-bye.